Good morning. Today's class we will see the remaining portions of medical surgical nursing. The first question: narcotics are contraindicated in people with high crane cervical injuries. Narcotics are generally not recommended for the people with high cervical injury because they can cause respiratory depression and compromise the breathing. So, when high cervical injuries can damage the spinal cord at the level of neck, which can lead to the paralysis of muscles that control breathing, making it more difficult for the persons to breathe by their own. So, if in addition to the respiratory depression, narcotics also can cause other adverse effects like sedation, confusion, and constipation. So, to prevent the respiratory depression and thereby the respiratory arrest, narcotics are contraindicated in the people with the high cervical injuries. The next question is: before aesthetic plastic surgery is performed, assessment of patient's reason for wanting the surgery is very important. Why? This is because aesthetic plastic surgery is a major decision that can have a significant impact on patient's physical and emotional well-being. And a comprehensive assessment should be made, include a discussion with the person to understand their motivations, expectations, and goals for the surgery. This may include evaluation of the patient's body image, self-esteem, and mental health. Thorough medical history and physical examination should also be performed to identify any potential risk or complication associated with the surgery. Assessment should also involve a discussion of potential benefits and risk of the surgery as well as the expected outcome and recovery period. The person should have realistic expectations of what the surgery can achieve and should understand that the outcome may not be exactly as they envision. So, because of these reasons, the aesthetic surgery, before doing an aesthetic surgery, the assessment of the person's reason for wanting the surgery is very important. Next question: a patient needs to be placed on immunosuppressants after organ transplantation. This answers we have seen in another form that the immunosuppressants are given in patients with the renal transplantation. It's same with all transplantation. After the organ transplantation, the patient requires immunosuppressant medication to prevent rejection of the transplanted organ by the body's immune system. The immune system is designed to recognize and destroy foreign substances in the body, including transplanted organs. So, the immunosuppressants are the medications work by suppressing the immune system, reducing its ability to attack the transplanted organ. It is important for the patients to take their immunosuppressant medications as prescribed and to maintain regular follow-up appointments with their healthcare providers to monitor for signs of rejection or side effects of medication. In some cases, the adjustment in case of the immunosuppressants may be necessary to maintain a balance between preventing rejection and minimize the risk of the side effects. Next question is: adequate dental hygiene is essential for clients on phenytoin. Phenytoin is the drug which is given during the seizures. So the patients who are having regular seizure, they will be on phenytoin. So phenytoin can cause number of side effects including gum overgrowth, otherwise known as gingival hyperplasia, which can lead to dental problems if it is left untreated. Gingival hyperplasia can cause the gums to become swollen and inflamed, making it difficult to clean between the teeth and increasing the risk of gum disease, tooth decay, and tooth loss. To prevent the dental problems associated with the phenytoin use, it is important for the clients to practice good dental hygiene. Clients taking phenytoin should also be advised to report any signs of gum overgrowth or other dental problems to their healthcare provider or dentist, as prompt treatment can help prevent further complications. So to prevent the gum hyperplasia, so the adequate dental hygiene is essential for clients on phenytoin. The next question is: blood glucose level is monitored on patients on prolonged corticosteroid drugs. Prolonged use of corticosteroid drugs can lead to increase the blood sugar level, which is known as hyperglycemia. This is because corticosteroids can cause the liver to release glucose into the bloodstream that will reduce the body's sensitivity to insulin and increase the insulin resistance. As a result, the blood glucose level should be carefully monitored in patients on prolonged corticosteroid therapy. It is particularly important for the patients already with a history of diabetes or those at increased risk for developing the diabetes. Important for the patients on prolonged corticosteroid therapy to work closely with the healthcare provider to monitor blood glucose levels and manage any potential complications. The next question is, patients may complain headache after administration of nitroglycerin. Nitroglycerin is the drug which is given during the hypertension. So headache is most common side effect of nitroglycerin, a medication used to prevent and chest pain and coronary artery disease. Nitroglycerin works by relaxing the smooth muscles of blood vessels, which increase the blood flow to the heart and reduce the workload of the heart. Headache can also occur due to dilation of the blood vessels in the head. The severity of the headache can vary from mild to severe, and it can occur immediately after taking the medication or several hours later. The next question is, a thallium scan is scheduled for a patient with MI or myocardial infarction. Thallium scan, also known as nuclear stress test, is a diagnostic test that can be used to assess blood flow in the heart muscle. It involves injecting a small amount of radioactive thallium into the vein in the arm and then using a special camera to take the images of the heart. Thallium scan may be recommended for a patient with a history of MI or myocardial infarction to assess the extent of damage to the muscle and identify the areas of reduced blood flow or ischemia. The radioactive thallium is taken up by the heart muscle, and the images obtained can help the healthcare providers identify areas of heart that are not receiving enough blood flow. The next question is, aorta is clamped during the repair of aortic aneurysm. During the surgical repair of aortic aneurysm, the aorta may be temporarily clamped to stop the blood flow through the aneurysm. This allows the surgeon to replace the damaged section of the aorta with a graft and a synthetic tube-like structure that serves as a replacement of damaged portion of the artery. If we are not clamping the aorta, there will be a lot of blood and the surgeon will not be able to do the surgery properly. So the clamping aorta temporarily stops the blood flow to the lower part of the body, which can lead to decrease in blood pressure and reduce oxygen supply to the vital organs such as brain and the kidneys. To minimize the risk of complications, the patient may be placed on the heart-lung machine, which takes over the function of the heart-lungs during the surgery. Next question, urinary output should be monitored for the patients on dopamine infusion. Urinary output is one of the parameters that should be monitored on the patients who are receiving dopamine infusion. Dopamine is a medication that can be used to increase the blood flow to the kidneys and improve the urine output in the patients who are experiencing low blood pressure or kidney dysfunction. Dopamine works by dilating the blood vessels in the kidney, which increase the blood flow to the organs and stimulates the production of the urine. As a result, monitoring the urinary output can help the healthcare providers assess the effectiveness of dopamine infusion and ensure the patient's kidneys are functioning properly. The last question, tetracycline should not be given with milk, iron or antacid. Why? Milk and other dairy products can contain calcium, which can bind tetracyclines and prevent their absorption into the bloodstream. This can reduce the effectiveness of the medications, can lead to treatment failure. Patients should not be therefore avoiding tetracycline with milk or other dairy products. Thank you for listening.